Hello everyone, I am Dr Mahesh Nair, founder and director of Nepentech Aesthetics Kochi, and today I would like to touch upon the topic of facial rejuvenation. Let me ask you a question today. How do you know whether you are a candidate for facial rejuvenation or not? The answer is simple. Take a mirror test. Stand in front of a mirror and observe your facial features. Look at yourself and think what bothers you the most. Is it a line, a new wrinkle formed on your face that bothers you? Or is it, under eye hollowing, dark circles, sagging skin, newly formed folds, grooves, maybe jowls, pre-jowls? What is it that bothers you? Is it the angles of the mouth that droop? Or any such feature which you have noticed lately creeping into your face? Or your neck for that matter, like a turkey neck, what they call usually, a wrinkled neck or something like that, which generally bothers you. And if the answer to any of these questions is yes, then definitely you need a facial rejuvenation or a neck rejuvenation along with it. So what options do you have in a facial rejuvenation? They can either be surgical or non-surgical. Non-surgical ones are generally considered when you have early signs of aging, or when there's just deflation of your face, that is loss of volume or loss of fat from your face. That is when you consider modalities like fillers, Botox, or maybe chemical peels, lasers to refresh your skin and make you look younger once again. But surgical ones come into the picture when you are beyond this stage, when the non-surgical modalities will not give you the result that you desire. The surgical ones include something like a neck lift, a facelift, an eyelid surgery for eyelid rejuvenation, maybe a lip lift as well as facial fat grafting. So being a surgeon, I would definitely like to highlight the surgical facial rejuvenation modalities, in which we begin with the most commonest one. Those are the eyelid surgeries, or periorbital rejuvenation as we call it, in which we include an upper lid, lower lid blepharoplasty. I know, fancy word, but it basically means eyelid surgery, wherein you take out excess skin and maybe some fat pockets which are bulging. Well, at the same time, you can inject a little bit of fat in and around the eyes to make them look younger once again. So these are generally daycare procedures which can be done under local or general anesthesia as per your requirement, and you go home the very same day. Now these eyelid surgeries can also be combined with a facelift or a neck lift to give you that holistic facial rejuvenated look. Like a facelift can be either a classical, a mini, again depending upon your assessment as to which areas of the face you need maximally the lift with. Along with that, the neck lift can also be combined, wherein the platysmal bands or the sagging skin can also be addressed. Of course, some of these surgeries have very fine scars which are concealed in areas which are, generally which don't draw much attention to, frankly. So don't be afraid of scars. These are very well concealed and hidden in all of these surgeries, and your face definitely looks rejuvenated at the end of these. Coming to non-surgical modalities, which can be used as an adjunct or maybe before your surgical modalities, we can also use these. That is fillers and Botox. So in Botox, basically we use a toxin to paralyze certain muscles of your face temporarily, and that gets rid of wrinkles and those dynamic lines on the face and makes your face look very vibrant, I would say. And fillers can be used to volumize your face, just like what fat grafting is used, but fillers have a little shorter life, and generally the effect lasts about 9 months to a year. So most of these facial rejuvenation procedures, whether surgical or non-surgical, are daycare procedures. Of course, fillers and Botox are daycare because you can finish in a few hours and you can be home. Even the surgical ones, frankly, you get discharged the same day. They can be done under general or local anesthesia. And the downtime, I would say, is roughly a week or two. Facelifts definitely have a longer downtime, but then even the results are that dramatic. So when should I consider a facial rejuvenation? Just like any other elective medical procedure, whenever you are in good health, you can come in for a facial rejuvenation.
Doctor, where do you take this fat from?
Oh, fat is very much taken from your own body, usually the lower tummy or your thighs or any other pocket of excess that you show me and you don't want it there, I can take the fat from there.
Okay, what if I don't have any fat?
Well, if you don't have any fat pockets, we do have other options wherein we can use facial implants like a chin implant or malar implants or a nasal implant. So all these implants also have similar effect, or if you want a shorter lasting effect, then definitely fillers are there for you always. Most welcome. So if you have any such questions, feel free to communicate with us. get in touch on the phone numbers provided, and we'll be more than happy to help you out with any of your queries. Thank you.